Dr. Leigh Erin Connealy is a prominent leader in the integrative functional medicine medical field, taking all of the best of all the sciences. She is the medical director of two amazing clinics on the screen, the Center for Healing and the Center for New Medicine, located in Irvine, California. The combined clinics have become the largest integrative clinics in North America, visited by patients from all over the world. Both centers focus on prevention and internal medicine, supporting her philosophy that we must treat the whole person. She created the Centers for Healing as a result of the epidemic spreading of cancer. Her patients receive scientifically based treatments and receive integrative protocols. She provides RGCC genetic testing as a cancer prevention method to determine the early stages of cancer years before a scan reveals it. And it allows her team to create a personalized treatment plan for early to late stage cancer patients. Many treatment modalities are used to treat and reverse cancers. She's also the author of two books, The Cancer Revolution and Be Perfectly Healthy. In 2017, she was named one of the top 50 functional and integrative doctors in the country. In 2018, her TV series as host of Dr. Detective TV aired for the first time, and she writes for many publications like the Townsend Letter. She serves on the board for Dr. Josh Axe, ACAM, and ACIM Connect. And with over 30 years of experience, she imparts her wisdom in educating medical practitioners all over the world, as well as public speaking engagements, webinars, and podcasts. With all that being said, please give a warm welcome to Dr. Leigh Erin Connealy.
Thank you. Is it on? Oh, thank you. Thank you for IAOMT for having me, and you guys have a good lineup of doctors tomorrow also. So I appreciate the invitation. So before we get going, I'd like to tell you a little bit about myself. So I grew up in Houston, Texas, and when I was 16 years of age, my parents received a letter that my mother took a drug called DES when she was pregnant with me. And that drug caused cancer in both male and female offspring, hormone problems, anatomical problems, infertility problems, a whole slew of problems. So that was a drug given in the 50s. They no longer use that drug to prevent miscarriage or stop bleeding. So fortunately, I went to medical school and was able to know how the body works. And I started my practice 35 years ago in Los Angeles, and I'm presently in Irvine, California. So my whole mission in life was really how to prevent disease because of my own personal journey. I started going to MD Anderson when I was 16 years of age. And approximately 15 years ago, cancer was just exponentially growing. And since I had learned early on how to prevent a lot of illnesses, I thought, oh gosh, we've got to prevent cancer. Unfortunately, people are not interested in prevention. But we've got to, the medical system today, we've got to all focus, whether you're a dentist, whether you're a nurse practitioner, MD, it doesn't matter who you are, what you are, you can empower and change one person at a time. Because as you know clearly, we are at a very serious crossroads with health. So heart disease is number one. Heart cancer's number 2, and number 3 is the properly prescribed use of medicine. And these diseases, despite the use of statin medication for the last 20 years, heart disease has not decreased at all. Cancer is 1 in 2 men and about 41% of females. And in the last 4 months in my practice, we have 70 employees, but about 7 or 8 physicians And in the last 4 months, the amount of young people with cancer is alarming. We are seeing more young people, when I say young, less than 40, so somewhere between 20 and 40, at an alarming rate. So I used to say that you had a warranty until you're 40, but now I can't say that. And we've got to all together change the paradigm and the way that dentistry and medicine is practiced, because now we see the connection, and we don't learn this in medical school. I learned this later, of the connection of the mouth to the rest of the body. And so we've got to completely change the way that we're practicing medicine. It's surgery or disease management with medications. And so most of my patients, they don't want to do surgery, they don't want to do medications, and so we are, we have a complete process of evaluation of our patients that you'll learn about. So this is the reality. I already discussed about the incidence and prevalence of cancer. It's only expanding and growing, and it's not. And I think it will probably be head and neck with, head to head with heart disease very, very quickly. And now breast cancer is now the #1 cancer over all the other cancers now. Otto Warburg got a Nobel Prize almost 100 years ago, that cancer was fundamentally an anaerobic disease. Anaerobic without oxygen. Without oxygen, you make lactic acid. And there's also glycolysis, which is sugar. And so when they do a PET scan, the cancer cells light up. So under normal circumstances, energy is produced of your ATP 90% with oxygen, 10% with glycolysis. Without oxygen, with cancer cells, they produce 50% of their energy by glycolysis and 50% using oxygen. So this variation of anaerobic glycolysis is the key to cancer cells. People think that cancer is genetic. It's about 5% genetic. They did an analysis of identical twins, 44,000 twins, and it was what they ate and their lifestyle. So you'll be hearing from Thomas Seyfried. I saw him on the lineup tomorrow, and that cancer is a metabolic disease, and Warburg's theory was correct. So people don't realize that cancer starts in the right, perfect conditions with one abnormal cell. So literally one abnormal cell in the perfect conditions. I mentioned sugar, low oxygen, and acidity, but it's also toxicity, it's bugs, it's nutritional deficiencies, but all these things. So that means we literally have 9 years of opportunity to prevent and practice early detection. And every practitioner can practice prevention and early detection. So with this just told to show you how many different things occur before we get a tumor. We don't just wake up one day with cancer. Cancer literally starts with a very perfect set of terrain circumstances, and then the cancer starts to multiply. So cancer's just not like, okay, we get a diagnosis and we do a little surgery and we do some chemo and we do some radiation. I wish it was that simple, that patients really wouldn't need to see a physician if it were that simple. There was a book written by William Kelly. He was a dentist. If you haven't read that book, you should read that book. And he had stage 4 pancreatic cancer and started really helping people cure their cancer. And one of them was digestive enzymes, specifically pancreatic enzymes. So a deficiency of pancreatic enzymes, because pancreatic enzymes play a role in digestion and cleanup of garbage in the body. Stress is probably one of the top causes of cancer, because if you have never read a book called Your Body Keeps Score, you are a bioaccumulation of events since you were in utero, and now they say 9 generations back, you inherit the emotional DNA and the drama and trauma of all of those generations, and then everything that you experience. So there was a very famous oncologist, Dr. Hammer, who who got cancer himself, and then he started asking all of his patients, why do you think you have cancer? And then they all related it to a stressful event. So Dr. Hammer's son was tragically killed, and then he figured out how trauma and emotion were contributing to his testicular cancer when he was 51 years of age. Over-acidity is a big problem, because the more stressed you are, the more pollutants you have, the more nutritional deficiencies you have, and the more infections you have, you're going to create acidity. Toxins. So this probably can't be exaggerated enough. The air we breathe, the water we drink, the food, the things that we put in our body, indoor pollution is 100 times worse than outdoor pollution. Toxicity is rampant in every single thing. In fact, on the way here, I was reading a book of one of my medical doctor girlfriends. She's really an expert on toxicity, and she just sent me a book on glyphosate, which is in probably a good percentage of the attendees here, because that's what they use for insecticides and pesticides. And it's a book on basically the scientific validation of how much this disturbs our whole microbiome, our nutrition, everything. And so if you haven't read anything about that, just pull up a YouTube by Stephanie Seneff. She's amazing, researcher, scientist from MIT, who's probably one of the most passionate researchers on glyphosate. Bugs, infections, viruses, fungi, parasites, biological factors. Methylation is huge. 50% of the population of the patients you're seeing have a methylation defect. It's not something you inherit, it's something you acquire. And if you have a methylation, you're at risk for cancer and all major diseases. Hypoxia, I already talked about, low oxygen, ATP, and then of course, dental health. You're going to hear from Dr. Levy tomorrow. He wrote the book Hidden Infections, and he talks about the connection of all dental infections and all diseases. So let's go in a little bit more detail into toxins. So as I said, it's probably last year at the American Academy of Environmental Medicine, all the speakers, they all talked on different topics, and every single speaker said that the number one concern we have is pollution. And so one thing you can do is start just reflecting on your own life and like what what your own life, what's involved, and from the water you drink to the water you bathe in to everything that you put in and on your body, there is pollution in there. So, there's a tremendous amount of food additives. A lot of them, they don't even put on the label anymore. So you have to kind of know your science with reading labels. Mercury toxicity, not just from mercury in the mouth, but mercury in the food. So we do heavy metal testing on every patient, and so mercury levels are usually very high in people who eat fish. So fish are loaded with mercury. They always tell me, well, no, I always buy wild caught fish. And I'm like, no, it doesn't matter if it's wild caught. The fish are ingesting the mercury from the air pollution, and probably worse is the nanoplastics in the fish. They've isolated all the nanoplastics now in placenta, so they're in everything and everyone. So electromagnetic fields, this is something kind of been a personal interest of mine for the last 14 years. And EMFs, if you haven't, the best book I've ever written on this, I've read a lot on it, is called The Invisible Rainbow by Arthur Furstenberg. It's an amazing book. It's something that everyone should be aware of, because we are living in an electrifying universe that is definitely affecting. They're seeing, glioblastoma has increased outrageously, which is a brain cancer. From most of the, I do thermography in my office. And so we took somebody and we did a thermography their head before cell phone use, 1 minute after cell phone use, 5 minutes, 5 hours, continuous inflammation just from using cell phone for a short period of time. So EMFs are a real issue, not getting any better. I know they are trying to stop 5G. I know the Robert Kennedy Foundation filed a 10,000-page lawsuit that we shouldn't be installing 5G. But any lawsuits take years and years and years and years to accomplish what you want to accomplish. But then there'll be a whole new slew of problems. Sick building syndrome. Lots of buildings have chemicals and or mold in the building. Radiation, lots of people get mammograms, lots of PET scans, lots of CT scans. Exposure, obviously nuclear radiation. Pesticides, that's why we encourage all of our patients to eat all organic. Industrial toxins, heavy metals, lead, mercury, arsenic. All heavy metals interfere with DNA replication. That's why it's so important. Xenoestrogens, that is xenos, the Greek word for, foreign estrogens. And I'll give you a study they did, and they took a water and they measured pollutants before they put it into a plastic water bottle. After plastic water bottle, with time, there were 25,000 different chemicals in the water. So xenoestrogens and phthalates are probably the number one biggest pollutant that I see in people's urine, and they're primarily from plastic. Polluted water, I read years ago in Popular Science about all the pharmaceuticals in water. So that's why one thing you have to have is a filtration system of some sort, and try to avoid any kind of plastic water bottles or plastic containers, period. Polluted water, chlorinated, fluoridated. Somebody's going to be talking about fluoride. You guys know about that. Obviously, tobacco and smoking. Immunosuppressive drugs really increase the cancer. And then all drugs, because all drugs are toxins, and they all interfere with the mitochondria, which are the powerhouse engines of your cell. So there's a strong connection of infections and cancer. So one of the biggest areas is the mouth, whether it's periodontal disease or root canal or head and neck. 50% of head and neck cancers are HPV related.
So, in fact, or if it's not HPV, it's something else. So there's a strong connection of viruses to cancer, Epstein-Barr with lymphoma, and more. Bacteria, we know that H. pylori is responsible for stomach cancer. Fusobacterium is related to breast cancer in women. Fungus, so there's molds, as I was said earlier, 50% of the houses and buildings have mold. And mold is a real difficult, it's real nebulous in its appearance, but you can easily do urine testing, which we do a lot of mold testing in our office just because we're excluding all of these issues with the patients. So mold testing, and it's very, very big. There's a great book that one of my friends just wrote called Toxic, Toxic, and it will blow your mind about mold. Candida is a common fungal infection. If people have taken antibiotics once, they're at risk of getting a yeast infection. So there's a strong connection with the environment of yeast and cancer because it makes the environment very acidic. All bugs make the body more acidic. So candida, if patients have hyperglycemia, which is pre-diabetes or diabetes, they're going to grow candida very easily. I can find it on a blood test very easily with patients who've taken numerous rounds of antibiotics. So be careful when you are prescribing antibiotics. Make sure the patient is loaded with good probiotics. I put my patients on a candida diet for 60 days to really change their environment so that they do not have proliferation of yeast. Now, parasites, you think, well, gosh, parasites, they don't exist in the United States. But actually, probably 50% of the population has parasites, and it's very difficult to diagnose parasites. So the stool testing is inadequate because by the time it's transported to the lab, the parasites have died. They used to do anal swabs and then look at under the microscope. The best guy is in New York City, and I don't even know if he's still doing it, but I know in other countries, in India and China, they are very good at examining in the slides of an anal swab and knowing. There is a guy in Arizona, Dr. Amin, who has a good parasite lab. But the problem is that a lot of parasitic infections are not in the intestines. So if you have a parasite in the spleen or the liver or the brain, then it's not going to be picked up in any kind of testing. So we do something called electrodermal screening, which is based upon Reinhold Voll. Dr. Voll was a physician and physicist who determined the acupuncture points of the patients, and he determined all the acupuncture points, and he can determine what systems were out of balance. Now, he taught it all by hand. It's all been computerized in something called electrodermal screening, and one of the best teachers is a guy by the name of Dr. Simon Yu. He's an internist, and it's an invaluable tool to figure out things that you can't figure out with blood tests and scans. Blood tests and scans tell you the obvious. As a practitioner, you're trying to figure out the invisible of what a patient has. So I know there's a whole dental evaluation that you can do with electrodermal screening, but Dr. Simon Yu is probably the best in the country at teaching dentists and physicians and other practitioners, but he likes to train medical professionals in this. So these are real, you think, and a lot of people don't have clear symptoms. You don't always have symptoms of disease. I can tell you how many patients come into me and the day before they had 0 symptoms and then they have stage 4 cancer. So it's really critical that we all as health practitioners do a very thorough, exhaustive analysis because you can save a patient's life. So acidity is a big thing, and when you always think about acidity, you think about your saliva, your blood, or urine, but actually it's really your tissue pH. And the reason why everybody's acidic today is because we are all working at breakneck speeds. We're all working, more than, we should be working, and we're all stressed, and we're trying to do everything that we possibly fit in a 48-hour day in a 8-hour day. And so acidity is huge. And when you add the toxicity that we carry, infections we carry, then we have increased acidity. So the best thing anyone can do is continually cleanse, infrared saunas. I'll go over it, what the things I recommend. So biological factors. So, 93% of the population has one or more nutritional deficiencies. So we check every single person's nutritional analysis. It's paid for by their insurance. And so it's very easy to know what someone's deficient in. I tell people we're guessing if we're not testing. And so you've got to test and know what the patient needs, because just deficiency in one nutrient can cause a lot of diseases. Look at scurvy, look at pellagra. Deficiency in one disease caused a very, very serious illness. In today's world, it's much more prevalent than it ever has been. I can't stress enough about the stress part. There isn't a person in my practice, pretty much. It doesn't matter what their label is. It doesn't matter what your diagnosis is, but everyone needs an evaluation and a guide on addressing stress. Thyroid. So thyroid's huge. There's been a 30% increase in thyroid cancer. And that is because of the eating, the very serious gluten allergy, because the wheat that we make today is not the wheat that we got 50 years ago. Heavy metals, EMF, and toxicity. As I mentioned earlier, glyphosate is one of the biggest pollutants that's going in our gastrointestinal system, and it's destroying the natural microbiome. Then hormone therapies. So look at the amount of women on birth control. I know they usually need it because they can't rely on their own. So, but then you have to counterbalance. So I always tell patients, if I have to do this, then we counterbalance it with that. Block detoxification. This is a big area because people get scars all the time. And what happens is you have acupuncture meridians flowing back and forth. And what happens is you don't have proper communication. So there's a methodology called neurotherapy with procaine. If you don't know about that, you should know about that. It's an unbelievable tool for practitioners to open up those blocked pathways. Cellular oxygen deficiency, the terrain, free radicals abound in vaccines. So these are all. There isn't just one cause to cancer. There is many, many causes for cancer. So again, I'm talking about the stress because if you look in the last 5 years, the amount of studies that showed about toxic stress and in a person's life is a result of chronic illness. It could be heart disease, it could be cancer, it could be MS, it doesn't matter. So it's really critical that you have a referral source. I personally don't do the work, but I have trained people in my office that do the work. which I'll talk about in a second, what I like the best, what I have learned over the years, because I want my patient better, faster. So this is, cancer and all chronic diseases are related to something called NF-kappa B. So NF-kappa B is the regulator of inflammation. So you can see how just when the cell is normal, and then with all the growth factors, inflammation, et cetera, it creates the final result of a cancer. So one of the biggest things that never talked about, and unfortunately, is vitamin D. You probably heard it more about with COVID than you did ever before. But vitamin D influences over 3,000 genes in your body, either upregulating or downregulating. Very important in cancer, very important in brain diseases, very important in heart disease. So everyone should make sure you have optimal vitamin D levels. That's one thing that we do, but every practitioner should be checking vitamin D on all their patients. And I like to try to achieve a level somewhere between 50 and 70. Some people I've heard recently, higher than that, but I'm more in the moderate as far as that. So in our practice, we have a dental evaluation. I do not do dentistry in my practice, but I do have great referrals of dentistry that I know that they are good at what they do in addressing, whether it is mercury fillings, or their root canals, or they have chronic dental periodontitis, and anything, because we know the mouth is the gateway to not just cancer, but to a lot of diseases, which you'll hear about that with Dr. Levy tomorrow. And so I find in my patients that when I always ask them, and there is a strong correlation of root canals. One of my dentist friends told me that a root canal is like having a diabetic ulcer in your mouth. And so it's a chronic infection. Now, I know every dentist has their way of taking care of those particular, and I'm not going to get into that because that's you guys' expertise. And but oftentimes there is, there's the patient directly, and the reason is it's just one of the many factors. It's not the direct factor. It is one of the things that create the perfect storm for a cancer patient. And so, but they usually, when you ask them, it's usually related to the cancer, the breast cancer that they have. And so the mouth drains into the lymphatic system close to the breast. And so patients, every single one of our patients needs to see a biological dentist. Obviously, I take care of the big problems first because most of our patients, unfortunately, come to us very advanced in their disease, and they usually have done everything. And so we have to prioritize, their issues. Obviously, I'm not going to go into digging deeper. I want to get into okay, so this is the big thing. I always tell the patients, it's not about the lump or bump what lies beneath. As I said, it takes 10 years to develop a clinical manifestation of a disease. And so Nixon declared war on cancer in 1970. Here we are in 2022, and cancer rates are increasing by the day in all age groups. It's the number one killer in people 1 to 85 years of age. And I can't urge everyone enough, just because I have the privilege and honor of seeing disaster, and not just me, all of our practitioners get to see just serious disaster. Now, if patients come to me early, which some of them do, and it's just really small disease, what I say small, stage 1 or 2, then I'm able to accomplish a lot. But once they have stage 3 and 4 cancer, you are doing unbelievably heavy lifting. And what worked 30 years ago doesn't work today, because we have outrageous chemo resistance, radiation resistance. And so we've got to all, everybody be aware of this. So in conventional medicine, the routine for a male is get a colonoscopy. The new age for colonoscopy or Cologuard is 45. They routinely don't do a PSA on men. I like to get a baseline, so then I can see the change. I don't use PSA as a diagnostic screening for prostate cancer, which is really the number one cancer I take care of. But I use it as a change. So if I have a patient who has a PSA of 1 and then they go to 2, I know there's probably a problem. And I do the workup, and sure enough, I find that there is an issue. So, but in men, there's no real screening except Cologuard or colonoscopy at the age of 45, and or PSA testing, which is not normally done on men. I would say occasionally. I had a stage 4, right before I came here, I had a stage 4 prostate cancer patient, 61, never had a PSA in his life. Athlete, does ice hockey, incredible, soccer player, etc. He starts having back pain, and it's worse than anything he's ever experienced. Never been sick a day in his life. Never been sick a day. Never gone to the doctor. Doesn't, go and get annual physicals, which is typical of men. Men don't like going to the doctors. Women start going to the doctor because of periods and pregnancy, and that's normal. But for a guy, all men get to my practice because of a wife, a daughter, significant other who drags them in. And I always tell them, I'm just going to confirm that you are Hercules. So just go along with the flow. So, because men don't, it's not customary. So that was typical for him. He'd never gone to the doctor, and here he is, full-blown stage 4 prostate cancer. So there really isn't any great screening for men. For women, there's your pap smear, there's your mammogram, and then there's the colonoscopy or Cologuard. So, but what about, there's no screening for head and neck cancers, pancreatic cancers, any kind of blood cancer, any kind of lymphoma. So we're missing a lot of cancers with our conventional workup. And doctors don't measure like vitamin D, they don't measure blood sugar. Patients with high blood sugar, which is pretty much probably 75% of the population, has pre-diabetes or diabetes, which predisposes you to all diseases. So all these things, C-reactive protein, you'll see when I talk about that. So we can't rely on our existing paradigm to detect cancer, because it is very inefficient in detecting cancer. So one of the biggest things that if you think we determine with you're making progress by shrinking cancer, but I've had many patients be in their treatment of cancer and they think that they are all done after 3 months, and come to find out they've got cancer in their bones because no one checked for circulating tumor cells. So that's going to be the future. So the other problem is we do lots of diagnostic tool. So a chest x-ray has 1 millirad, but a mammogram has 343 millirads. Chest CT scans and PET scans have an outrageous amount of radiation. So like for patients in my practice, I tell them what to take and what to do to detox from radiation. Radiation is cancer causing. That's the reality. The other thing is that biopsies. Doctors do biopsies all day long without thinking about the consequences. Once you've punctured that capsule, you've caused inflammation and immunosuppression. So that's another thing. Before we even send a patient for a biopsy, we have them do a preventive protocol preventing spread of cancer. Not to mention the emotional aspect of the patient having to think about getting a biopsy. So cancer is a chronic illness, so we have to be doing these evaluations. So as I said earlier, when you get a biopsy, you have to think about possible metastasis, and I've seen it. It's injurious, it's stressful, and it's immunosuppressive. So it's very important that you do preventive, proactive measures for the patient. So how do you know if you have cancer? So a doctor should always perform a comprehensive history and physical exam. You know, patients a lot of times don't pay attention to their bodies. And so when you point out things on a physical exam, which we've kind of lost the art of the physical exam, and especially in the last 2 years when doctors have chosen to see patients in phone and Zoom, which did not happen at my practice. We remained open. We said we have to see patients physically. It doesn't replace. Yes, if it's a quick situation or something very small, but you always, can you imagine doing dentistry through Zoom? No, it's impossible. You must see the patient. You must examine the patient. And I will tell you, I was doing Zoom and phone way before COVID because my patients will do a call with me or a Zoom with me before they come out. And then when I see them and I see like their breast mass or whatever that they had going on, I'm always like, oh my goodness, this is way bigger than I even thought of. So in the blood test, one of the biggest markers is a C-reactive protein, which is something easily that can be done. C-reactive protein is a non-specific marker for inflammation. If your inflammation level is even a little high, we know there's a problem. And I said it's non-specific, so that means it doesn't tell me where it is and what's causing it. So an ideal C-reactive protein should be less than 1, 0.5. So I hope everyone in this room knows their C-reactive protein. How many people know their C-reactive protein? 1, 2, 3, 4, 5. But everyone should know. It was on the cover of Time and Newsweek a dozen years ago. So that should be a priority for you to know your C-reactive protein. If it's over 1, you know that there's inflammation going on in the body. Serum ferritin. A lot of people have elevated ferritin. Ferritin is your storage of iron. It's very inflammatory. If you've looked enough at people's cancer, their blood tests, you know that patients with cancer have very high ferritin. Now, there are people who have fatty liver. 50% of the population has fatty liver. What happens when you have fatty liver? The liver cannot properly metabolize the iron and ferritin, and you get an artificial elevation. It's not artificial, it's real. And then the doctor needs to order phlebotomy, which is removing blood, or you donate blood. That's a lot of athletes do it to enhance their performance because iron is inflammatory. It damages your brain, your heart, your liver. One of my doctor girlfriends, she was an OBGYN, practicing conventional medicine, 20 years, got sick, got so tired, ended up Mayo Clinic in Arizona diagnosed with hemochromatosis, over storage of iron, which is way more common than you think. They said, oh, we need to do a heart and liver transplant. And she said, what? So then that's how she learned integrative biological medicine. It's a true story. Thyroid function, your thyroid is the battery to your body. It sits here in your neck. You need to do a complete thyroid panel. Thyroid disorders are escalating at alarming rates. Autoimmune thyroid, low thyroid. So you must order a complete thyroid and know, because it's the battery to every cell in your body. The cancer profile test is done by American Metabolic Laboratories in Florida. And it's a fasting blood and urine, and it tells you it's certain markers that can detect that there's some abnormalities. And what they check is quantitative HCG. HCG is the hormone of malignancy. It's also the hormone of pregnancy. So if a woman's pregnant, she can't do the test. It also checks for CEA, which is a nonspecific marker for cancer, a liver function test, thyroid function, and a really important test called the PHI. It's the enzyme of hypoxia. So, as I said, Otto Warburg got a Nobel Prize that cancer is low oxygen, and it is a more common problem than you think. So I do that on certain patients. I decide what way I'm going to do it. If I'm looking for early detection and prevention, I will decide which array of tests. Always the comprehensive testing, but then I do cancer profile, but then you'll see I do the circulating tumor cell test, which is down there at the bottom, and that's done by a lab in Greece called RGCC. They've been around for about 18 years. They have the most sophisticated cancer testing in the world. Yes, there's some labs here in the US, but they do not work. They are not accurate at all. I've used them. I will always send 25 specimens to see, and to see how good a test will work. And but I haven't found anything comparable to RGCC. And I've used labs in Europe, I've used labs in the United States, but nothing comes close to the RGCC test. So if you just wanted to figure out if someone had cancer, you would order something called the OncoTrace. And it looks for circulating tumor cells, and then it looks for what cancer it's most identifiable. Is it melanoma? Is it renal cancer? Is it prostate cancer? Is it breast cancer? So it's about an $800 test, so it's worth its weight in gold, because if you can prevent your disease, an ounce of prevention is worth a pound of cure. If you want to have the experience of working with me for a couple of days, you can come see it, and then you'll be convinced. The bioimmune survey is something that I learned in my journey of my own personal, since I was very interested in cancer prevention. So I went to a medical conference and in Las Vegas, and they talked about this bioenergetic testing, and I was like, whoa, this sounds like really kind of woo-woo for me. So then I said, well, I don't know anything about it. Let me go research it. So anyway, to make a long story short, I researched it, learned all about it, and I'm like, okay, let me see if this works. So I started doing it on my patients, and it literally told me every single thing I needed to know, including a timeline for cancer. So I started implementing that for I've implemented now for 24 years. And so it's become an invaluable tool in my workup. I charge $250 for an hour and a half, and it will give me the most incredible information that I could possibly find compared to doing, a medical workup doesn't cost that much money. By the time you can get a good blood test, a comprehensive blood test for less than $300 today. The OncoTrace is $850. The bioimmune survey is $200. it is outrageously inexpensive for any patient, and in you guys incorporating these little things in your own practice to do can be invaluable. Now, thermography I use, it's been around for literally 70 years, and it looks at the vascularity, image, and inflammation of a tissue. So I can do whole body, but I do a lot of breast imaging. Since you cannot detect all cancers with mammograms, for every 10,000 mammograms we do, we save one life. So mammograms are not an effective tool. There's been many studies. There's already 3 or 4 countries who do not recommend them as a regular screening tool because they're not finding the disease that we're looking for. So you can see that, you know, when we work up a patient, that we don't just use, you know, little history and a little physical and conventional blood work. Most doctors, what I see around the country, order a chemistry panel, which looks at your electrolytes, your kidney, and a CBC. So nobody checks CRP, nobody checks D, no one checks hemoglobin A1C, no one checks like real basic laboratory assessments that you can do. We use a lot of plant medicine in our office, a lot of herbs. Nutrition is huge. All of our patients they come in, actually a lot of them already very schooled and educated on eating. And if you go with the food model that exists today, that will not achieve health. All you have to do is look around and stand on a corner, and you'll know that people are not healthy. Conventional medicine, we do all day long. We do all the conventional medical workup. We order PET scans, CT scans, MRI, everything. We do all of that. It's an invaluable tool. I couldn't do my job without it. But again, you know, we're doing comprehensive evaluation. If you're going to serve the miracle of your body, you've got to do. So this is like what if first blood work. I won't do all of this, but possibly do a lot of it. So that's like kind of what I would do on a patient in the very beginning. And all these markers tell me certain things. It's interesting, the guy that I saw Thursday, he had stage 4, and they had done, I have to say, 1,000, I mean, the chart notes from the hospital were, you know, like 100 pages. So they were trying to figure out, because they didn't know what he had, so they were doing every test, every scan, endoscopy, colonoscopy, to find out that he had stage 4 cancer. So yesterday, my girlfriend called me, and she said that her son, who's at University of Montana, is 20 years of age, and he got pneumonia. And so she says, oh, they think it's March now, it's March. And they go, they think he has either testicular cancer or some other cancer. And I'm like, December to March, and they're just now figuring it out. Your first question should have been, why does a 20-year-old have pneumonia? So I didn't tell her that. I just said, let me know, because she called me for my help. But I'm like, this is the problem. We should have been figuring this out. A 20-year-old with pneumonia, you know there's a problem. A 60-year-old might have pneumonia, but you'd question that, but not a 20-year-old. So anyway, here's for sure, he definitely has some kind of cancer. They just haven't figured it all out. So I just tell people it's so much easier for yourself, for your loved ones, to do these preventive testing. So the future of oncology is going to be circulating tumor cells. So circulating tumor cells occur when the one cell has turned into 1 or 2 millimeters. So 1 or 2 millimeters is like 2 pencil lines. And circulating tumor cells are released in most patients. Nothing's 100%, but I would say in most patients. So if a patient comes to me and wants prevention, I do the circulating tumor cell OncoTrace test. But what is more important, that this is what's responsible for 90% of metastasis, the cancer traveling to a new home, nest, or residence. So you've got to know this at some point in time. If I have a patient diagnosed with cancer, I immediately do it the first visit. If they've had cancer and they want to prevent cancer, obviously I do this test. And if a patient says, Dr. Connealy, I just want to make sure I don't have cancer, everyone in my family has cancer, I need to make sure that I don't have cancer. So circulating tumor cells, that's what drives the tumor and drives the spread of the cancer. So this is a lab. I have no affiliation with RGCC. I've just been using them for 8 or 9 years. And I do know the medical director, Dr. Papizzaru, who is a workaholic and absolutely passionate about having the best lab that there could possibly be. I do know that. So this is what the test will show. So like if I have a patient with stage 4 cancer, I will order a comprehensive testing to not only check circulating tumor cells, but what works on circulating tumor cells, which is the natural substances, and then every chemo agent and every smart drug that's available on the market today. And then I will submit 5 things that I know may work on the patient. They may be drugs, they may be natural things, so I will submit those myself personally. They will allow any testing for any substance to see if it works on your cancer. This is the energy testing I already told you about that I do. I call it the acupuncture meridian assessment, and that will tell me, I tell people you're a biophysical, you're a biochemical, and bioenergetic being, and so we have to evaluate all those parts. We take the top 50 acupuncture points, we measure the energy flow or lack thereof, and then we figure out what is blocking that energy point. This is the breast thermography, and usually I use it in addition to mammography and or ultrasound and or MRI. So what are the big lifestyle things? Well, the food is the single greatest determinant of your health, but it's more the quality of food that you do, but you choose. And so it's very important. Food is information that is going to dictate the biochemistry of your cells. So it's really important that you have the right information that's going to dictate your disease. And so we use different eatings. Dr. Seafried tomorrow is going to talk about ketogenic, but ketogenic isn't for everyone. Sometimes I tell people to fast. Some people I do modified fasting. Some people I tell juicing. Everybody comes into me differently, and so I will prescribe what I think is best for their blood work, their cancer. What if they're anemic? If they're skinny, I can't put them on a fast. So all different things come into the factor. I use lots of different natural things, like I said, for fixing cancer. I have hundreds of things that I use. I have some top things I use. I use RGCC as part of what that comes up there to kill circulating tumor cells because only natural substances kill circulating tumor cells. So I use a variety. It's like a puzzle, and so I have to figure out. I always tell people you treat the patient with the problem, not the problem of the patient. Movement, one of the biggest things, there's 800 muscles in your body, and unfortunately, we are all sitting in computers and have sedentary jobs, so it's very critical that we move your lymphatic system, helps your immune system, you sweat, all different things, so exercise is invaluable. Movement is medication, so. Now this is probably one of the big things, is purification. So these are the different things that I have patients do. Most people don't drink enough water. Like I said, 50% of the population has parasites. I always have patients do liver cleanses, either do a liver flush or coffee enema, green juices, depending again on the patient. Far infrared sauna, single best investment you can make in your health. Chelation to remove heavy metals. Again, everyone doesn't get that. I customize it depending on the patient. Lymphatic drainage, absolutely every single person in our clinic gets lymphatic drainage to begin with cancer. Skin brushing, exercise, emotional detox, meditation. Hydration, most of us just don't drink enough water. Your body, when you were born, was 90% water, and we just need to drink our, enough water. Sleep, 50% of the population is sleep deprived, and so you've got to figure out how you can have 8 hours of good sleep without medication. So there's lots of different things that we can all do to create a sleep sanctuary. So this is one of the biggest tools I use for emotional conflict, and it's called EVOX, and it's a phenomenal tool. It takes 5 or 10 treatments, and it's really much quicker than typical psychotherapy. So this is why we use this, because we used to do psychotherapy, but that was a very slow process. So we have found through EVOX, and what you do is you start talking, say, my name is Jane Doe, and I was born in Toronto, Canada, and la, 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 la. And then the brain is programmed on the computer, and it tells the practitioner what the conflict is, and then the conflict's worked out with the practitioner and the patient. But I love it because it's quick. I want people better in 3 months, not a year, 2 years. I need to get them better faster. So these are all the possibilities of things that we do in our clinic. These are things, just food for thought. Again, not everybody does all of them. It just depends on where the patient is in their health journey. So you can see that it's not just, okay, here's some, get on the conveyor belt of surgery, chemo, and radiation. It's a combination of therapies in partnership with the patient and really changing the patient's lifestyle. So, and this is the key thing, prevention. So thank you very much.